So, Dr. Miller here, and I'm continuing with some of the questions that I receive most from my patients. And so, a lot of patients have never heard the term the microbiome. And so, the microbiome actually, in medicine right now, when they talk about the microbiome, they're talking about the gut. But the wholeome is all the microbes that make up everything around the body and whatnot. But the microbiome is just now hitting its stride. I have been interested in the microbiome since 2012 or 2013 when I was looking at myself and I was going, what in the world? I'm running, I'm doing all these things, I'm exercising. What's the difference between me and these people who are all ripped and fit and doing what, just looks like they can eat whatever they want and they just continue to look good and aesthetically? And then why do some people who are healthy die early, like my mother? And then why are some people who look unfit and unhealthy, like my dad, outlive my mother until for a long period of time? And it just did, there was 10 years between their deaths. And so it really fascinated me as to why. And one of the things was that kept coming up is the microbiome. And so this is one of the questions that I get a lot is what is the microbiome? And so I will give you some of the books that I have read over the past 20 years about the microbiome that teaches you about the microbiome. But let's get into how important the microbiome is. If you go on to PubMed and you type in the microbiome and health and the microbiome and whatever, there are literally 10 papers coming out, if not daily, weekly, because it's the new frontier. And so they're trying to glom onto this, and you're starting to see, even nutrition. Everybody wants the next latest and greatest thing. Well, the microbiome has been around for as long as people have been around, and you can manipulate it through what you think, how well you're sleeping, what you eat, all of those things. But because humans are just the way we are, which is we want it right now, we want the magic pill or potion that actually fixes this for us immediately. So now you're seeing this, and I've used these things to help people, but you see the pendulum acromancia, you see metagenics coming out. Both companies I use, I like, but this is so important to your foundational health that I want you to understand what all the microbiome influences. And then I want you to know that you directly affect and change the microbiome how you want to. And the microbiome starts to change. They used to say within 3 days. They're now showing it changes meal to meal. That's how important this is. So let's start off with the basic of basics. This deals with digestive health. The microbes that you eat actually go into and start to break down the fiber, and they eat this, both the insoluble and soluble fiber. The insoluble generally is also pushed through the colon. I kind of tell people it's like a Brillo pad or a scrubbing pad, and it helps go through and clean out the intestines and stuff like that. But a small amount of that is also used by the microbes. Soluble fiber is actually digested by your microbes in the gut, in the intestine, in the small intestines, and it makes all kinds of things. Most importantly, things like butyrate, your short chain fatty acids. Um, these are things that you have to have. Butyrate is very important to your intestinal lining and gut health. The next thing that the microbiome does is it helps educate your immune system as to what is happening. It balances the inflammatory and anti-inflammatory properties and responses that the body does. The main thing that I have seen in my years of dealing with the microbiome and my years of dealing with autoimmune issues and problems that people have, the thing that I have seen is there are two families that are the biggest majority of the microbiome that we know of now. We don't know it all, but that we know of now are Bacteroides and Firmicutes. Those two are in a ratio of about 2 to 1. The Firmicutes are your pro-inflammatory. They help your body go out and heat up to kill things. Your body kills bacteria and viri and stuff like that through heat, through your fever and stuff like that. So, and I mean, yes, you have T killer cells and you have lots of other things, but the firmicutes is that part of the immune system. The Bacteroides is the anti-inflammatory portion of the microbiome. So when you see these things and you now start to have a very basic low level understanding of how the body actually helps with the immune system. Also, when we look at the immune system, it helps regulate peptides. It helps you produce the peptides that you need so that insulin's a peptide. It helps with that. There is a peptide out right now called BPC-157, which is a healing peptide. Now, this is an artificial peptide, but it's based on a peptide that your microbiome produces in the gastric juices. So you actually produce these things endogenously. And also, your gut is the first line of defense. It is the first part of the immune system. And it's called the GALT, the gut associated lymphoid tissue. And this is the thing, this is your first line of defense against the bacteria and pathogens that you consume. And it is part of your immune system. So now we're going to go into what I am very concerned with. Both sides of my family, the Bergmeyers and the Millers, have obesity, diabetes, cardiovascular disease running rampant through both sides. My dad's family was or is very large. My Bergmeyer side, and it's kind of hit or miss. So where the microbiome comes into this is called metabolic health. And this influences, the microbiome influences metabolic health because it is part of what extracts the energy out of your food. And so I have what is called the thrifty gene. Basically, my body can extract very efficiently everything out of food. So I literally gain weight very easily, not due to an insulin response, because my fasting insulin is between 3 and 4. So, and my insulin response when I eat food is actually correct. So my being heavy is because actually I do like to eat food a lot and my microbiome is very efficient. So when dealing with myself and not wanting to be 350 pounds like my father, I can sit there and say, all right, I can have one large meal a day, but then I am better off with either one meal a day or just a couple of smaller snacks later on. I typically tend to be able to modulate my weight that way. Plus, I'm an endurance athlete, so I can actually, if I am out doing my two-a-days with biking and running or weightlifting or whatever, I can then take that caloric intake up a little bit. But for me to maintain my 250-pound frame, it's not hard for me to just eat 1 or 2 meals a day, and I stay there. It doesn't matter. So that's how one way. that it actually affects the metabolism that your body does. The microbiome also in this metabolic region, it affects insulin sensitivity. And insulin sensitivity is the ability for your cells to be sensitive to insulin. And so when we start to look at this, we also start to think about type 2 diabetics and things of that nature. So the higher that your insulin gets pushed, the more you tend to actually gain weight. So when I was a lot heavier, that was the first thing I actually started to address in myself was insulin sensitivity and getting my consumption down to the point that I could maintain my insulin levels, maintain that insulin sensitivity. I've also noticed that I've used a CGM. I am more insulin sensitive in the mornings than I am in the evenings. So I generally push my first meal of the day to later in the morning, and then I break that fast with a larger meal that I get to enjoy. And then throughout the evening, if I just get a little hungry, it's a snack. But part of that is that insulin sensitivity and the way the microbes actually tell you what they want. So if you are in control and you don't sit here and eat gluttonously or binge eat, then if you listen to your body, it will tell you what it wants. And then you can go get those. A lot of times, sometimes hunger is mistaken for thirst. So for people who are having a hard time with their weight, start drinking a lot of water and see if you don't help start to modulate that. And that's just a tier one, super easy thing to do. And definitely doesn't fix the problem, but it starts to help get you pointed in the right direction. The next thing that deals with metabolism is dysbiosis because a lot of people I see that if you look at them from the sides, they're good here, but when they turn this way, all of a sudden, woof, they get a big old belly, and we call it, beer gut kind of is a tire all the way around, or you have just that, the person that eats food and gets that food bloat and that pregnant belly after they eat, that's dysbiosis. People who are eating food and they get diarrhea and they don't know why. And it's always, we just had a patient come in and they were talking about how um, we've changed their diet. We have them increasing their fiber, but they're getting diarrhea. And he goes, well, I just control that by eating cheese because he basically forces the system to slow down. And I was like, wait a minute, you're having a problem with dysbiosis. And so we need to take a step back and let's start to address this. And we started to address that. And then it gets the doctors that tell you they heal it or they fix it. It's not that we heal or fix it. We're giving the body the things that it needs, or we're telling you how to give the body what it needs so that it actually heals itself. The body does the healing. Whether you talk about chiropractic, talk about functional medicine, technically, even in medicine, when they're blocking that pain response, they're trying to give the body the time it needs to either A, heal, or B, accommodate to what is happening so the patient doesn't feel pain. And once again, that dysbiosis is also related to type 2 diabetes. So it's very important to realize that the microbiome, people who have very diverse and robust microbiomes hardly ever have diabetes or some type of metabolic disease. And this is something that happens so often that, yeah, correlation is not causation, but it happens so much that you actually can't deny the relationship. Next, we want to really talk about the neurological, the brain effects that the gut has. So it's called the gut brain axis, and your microbiome influences the brain in so many ways. First off, It helps with the production of serotonin, dopamine, GABA. All of these neurotransmitters are predominantly produced in the gut. And that's what makes you feel good, what makes you happy. And then it also helps with the gut, actually helps with the stress response. And that is through the HPA axis, the hypothalamic pituitary adrenal axis. This is how the microbiome actually affects not only gut health and brain health, but thyroid health. So a lot of people who have thyroid issues and thyroid antibodies and things like that start to have all kinds of other issues. If you're stressed and you can't deal with that stress, then the mucus layer in the stomach starts to thin a little bit. And that's because you want to absorb nutrition as quickly as possible. And so I kind of say it's the body's way of saying, I want quick energy. I don't care. I'll clean up with the immune system afterwards, but give me energy because I'm ready to fight or flee. The thyroid starts to make changes the same way. Typically, well, let me say this. If you are under that stress response for a long time, the thyroid gets tired and it pulls back, and we start to see reverse T3 jump way up. We see the function of the body, the metabolic function start to slow down. And that's chronic stress. There's a great book called Zebras Don't Get Ulcers because basically they're eating, and as they eat, when the lion comes along, it's game on, and they run like hell, and they either A, get away, and then they don't have to worry about it, so the stress response is over, or B, they get eaten. So either way, they either get away and sorry, they either get away and they're not eaten and they go back to grazing, and it's literally that fast, or B, they do get chowed on, and then there's no worries anyway because game was over, they lost. The next thing that the brain, the gut brain axis, HPA axis, all of that, the next thing that that deals with is it is very linked to anxiety, depression, and even neurodegenerative diseases. This is when and I'll cover this here in just a little bit, a little more, but neurodegenerative diseases are also linked to autoimmune diseases, which the microbiome affects. So, as you can see, the microbiome influences everything. And people have to understand that. And they have to treat this with food. And this is one of the things I'm going to get a little off to the side. America is one of the sickest nations in the world. If we go back, and I've said this multiple times, I'm going to repeat it because it's just the statistics, it's just the facts. We are 4% of the world's population. During the pandemic, we were 16% of the deaths. So if we're 4% of the population, we would only expect to be 4% of the deaths if everything else is equal. But it's not. We have the most advanced healthcare system in the world. We had the immunization before anybody else. We're supposed to be cutting edge, and our system, our healthcare system, is the most expensive. So you would actually expect us to die at less than 4% the rate, but we didn't. We died at 16%. So we were 4 times more likely to die than anybody else. CDC said, well, wait a minute, why is that? And when they asked that question, they started to do the research. They found because Americans are the only nation in the world that carries four, but 3.8, four chronic diseases. So you're suffering from diabetes, you're suffering from multiple sclerosis, you're suffering from autoimmune diseases, you're suffering from high blood pressure. These things are things that everybody in our society is walking around with. We think it's normal. I'm very blessed to be able to travel all over the world. And let me tell you, when we go to other countries, even Mexico, which used to be more unhealthy than we are, they had more obesity than we had. Not that way. It's we are sadly the most ill nation in the world. And this is why I do what I do. I don't want my children to suffer that same fate. So, neurological diseases and mental health, they go together with the gut just like peanut butter and jelly. Next, let's talk about cardiovascular health. Now, when we start to talk about cardiovascular health, there is a in my brain, I'm getting a little off because I'm actually, as I talk about this, making connections. My genetics don't allow me to actually make K2 endogenously. And so, since I don't do that, I have to take K2. If I got all of my K2 naturally through eating natto and fermented foods of the like, but in America, we don't like these things. And since we don't like the taste of these things, we don't have them. So my ability to get K2 through food is limited. And my ability to actually metabolize K2 and then have that in the blood and pull it out, I have to supplement. I supplement with 50 micrograms a day because I've had my uncle die from an abdominal aortic aneurysm. My mother had one that was ready to be caged, and she died before that got caged. There was no autopsy performed, so we don't know if she died, but how suddenly she died, it almost has to be an aneurysm. So, regardless of that, cardiovascular health. So, if you have the microbes in there that actually help produce that, which you can get and cultivate and eat, then you don't have to supplement with that. But it also metabolizes carnitine into TMAO, triethylamine oxide, which is linked to heart disease. So you have to have the microbes and the abundance of microbes to take that choline and carnitine and keep that from developing. And that's what your body does. That's how your body does that, or it's one of the ways. That's with the microbes. Now, you can take things and nutrition and supplements, but regardless. Oh, and one thing I also forgot. If you have a diverse microbiome, then it can increase your caloric burn at rest, your basal metabolic rate by 10%. And that's pretty impressive. Next thing is, along with the cardiovascular disease and things of that nature, that cardiovascular disease, the microbiome helps you metabolize your lipids. It helps modulate cholesterol. It helps with the ability of the LP little a and the APOB 100, all of those things. It helps metabolize those things and get them out of the system. Plus, it's what produces your short chain fatty acids and things to keep the vascular, or to keep the vessels, the blood vessels, healthy, pliable, opening. Next, my wife's favorite thing, I should actually get her in here and let her talk about hormones and how the microbiome affects hormones. But we have what is called the estrobolome, which they're starting to see because we have so many foods that push estrogen. We need to have the microbiome that actually metabolizes that. And so if you eat, once again, lots of fiber, but if you eat lots of fiber, the fiber, once again, helps with the microbiome and it allows the microbiome to bind to the old fiber and get it out. And this helps with estrogen dominance, PCOS, endometriosis. It can affect all of those things. Plus, it affects cortisol, which affects stress and inflammation. Once again, I should get her in here and have her go over that because she loves the hormones and deals with that a lot more. But this just falls in line with everything that the microbiome affects. Autoimmune diseases, when the uh, Bacteroides and the firmicutes get flip-flopped, you're more pro-inflammatory. When you have autoimmune Hashimoto's, thyroiditis, the molecular mimicry is what is attacking the thyroid. And so when those two get flipped, the immune system stays on. And this, let's roll it back to the pandemic. Did the virus itself cause death? No, the virus did not cause the death. The response of the body and the cytokine storm that the immune system started caused the death because we also couldn't shut it off. You couldn't regulate that. The microbiome, using the bioflavonoids and polyphenols from vegetables and a variety of foods, is what actually regulates that. And so and I've seen this in my own clinic, where we have people that have a higher Firmicutes than Bacteroides, and we have to get that flipped. And you do that actually through the manipulation of the types of fibers that people eat. So an imbalance in the microbiome has been associated to rheumatoid arthritis, multiple sclerosis, and lupus. So you really want to know what is going on there. Next is cancer risk. The gut bacteria influence carcinogenic metabolism and detoxification. So, meaning that the way that your body breaks things down and then eliminates them, it depends on what your microbiome looks like, and that has been directly linked to cancer risk. There are actually, I was listening to Dr. Peter Attia, and he was talking about people who they're getting a new type of cancer treatment, and they saw that people that were missing the microbe Akkermansia muciniphila did not have the immune response that they needed. And so the cancer therapy failed. But when they supplemented with AK or AM, Akkermansia muciniphila, when they supplemented with that, the immunotherapy actually worked. And Akkermansia, as well as Faecobacterium and Roseburia, are three bacteria that you have to have for the maintenance of the gut, the gut-associated lymphoid tissue, the slime layer in the stomach. You have to have those. If you don't have those, things start to break down. And then, as the Chinese say, death begins in the gut. And it truly does. The last thing is longevity and aging. And healthy microbiomes are linked to taking the inflammatory response and quelling it, being able to turn off the immune system. And how do you turn off the immune system? How does the microbiome turn off the immune system? Once again, it uses the polyphenols and the bioflavonoids from foods to modulate that inflammatory response. Plus, it educates the immune system very simplistically. What is friend and what is foe? What should I have tolerance to? What should I not have tolerance to? Let me look at the note here. My gut diversity declines with age, correlating with frailty and cognitive decline. So that's the last little note that I have seen on that. Before you go, here are some great books. I've been reading on the microbiome since the first books came out in 2012. So you have the Microbiome Solution. That's a great book. For people that are watching this that are worried about their health, that is who I generally get. A great book is called The Walls Protocol. Dr. Terry Walls reversed her Uh, she reversed her aggressive multiple sclerosis through using basically diet. And diet, supplement. She did the 5-hour program. I mean, she really aggressively applied functional medicine to her MS and went from a tilt recline wheelchair back to practicing medicine. So that book is incredible. How I Beat Progressive MS Using Paleo Principles and Functional Medicine. Next, this is something that's affecting Americans more and more, is missing microbes, because we take so much medication. We are the number one consumers of pharmaceuticals on the planet. So we're killing things off at exponential rates, and the body just doesn't have the ability to come back. And so you really, really, really need to have these concepts in your head. And yes, we can help you with this, because we can help you implement what you need to help yourself heal. We have people all the time that come in here. We've dealt with aggressive pulmonary autoimmune diseases. We've dealt with lupus. We've dealt with multiple sclerosis. We've dealt with diabetes left and right like crazy. And oh, let's see, just some of the few that come to mind: vitiligo. Um, we have a prostate cancer patient, and that's current. So we see these things all the time, and we see them heal themselves and get better. It's hard to actually put a metric on, are we elongating their life and giving them lifespan, or are we helping their quality of life? I do know we're helping their quality of life, hands down. How do you measure longevity? You know, how do you take somebody and say, well, you were only going to live to here, and now you're going to live to here? So you don't know those things, but unequivocally, we have the questionnaires and the results that show that these people are more active. They feel much better. They get their lives back. We release them. And then if they have a problem, they can call, text, whatever. We can give them some things to do. Hey, do you remember this? Did you start to get back into this? Blah, blah, blah. And then they get to go back in and take care of it themselves. So, as a chiropractor, once you go to a chiropractor, you always go to a chiropractor. It's not that way with a functional medicine doctor. If you see us, we get you straightened out, you're gone. And then we may see you in 6 months if you had some sort of weird thing, to make sure it's not coming back. But otherwise, hey, call us if you need us. This is your brain on food, and that's about the microbiome and how it affects anxiety, depression, all of those things. So, books have been written on this for a long time. It's now hitting all the research, and people are starting to glom onto it because food matters. You should do food first medicine wherever you are, whatever you're dealing with. Next, this book was absolutely fascinating, and it is called The Human Superorganism. And it talks about all the different links that the microbiome has, and how the microbiome is revolutionizing health. And let me say that again, it's not revolutionizing sickness and health care, it's revolutionizing health, because food is medicine. And you can either have recreational drugs that are killing you, or you can have things that are building you up and making you better. I hate to say medicine, because we all think about the pills that doctors give us. Typically, those things are just meant to cover up the symptom while the body starts to take care of the problem. And I don't like blanket statements, and that's a blanket statement. And I can think of things that you absolutely have to have. If you've done so much damage and your blood pressure is super high, then yeah, you got to be on blood pressure medication, or else you're going to pop an aneurysm. So, that's not necessarily building you up, but it is helping with it's helping you in the moment so you can figure out why the high blood pressure is killing you slowly. You absolutely should not be taking a high blood pressure medication and thinking that is your salvation. It is a stopgap. Because what happens? First you're taking one, then you're taking two, or the milligram dosage goes up and up and up and up and up. So you have to be doing something like functional medicine with us to figure this out, to lower blood pressure. And we see it all the time. I don't think we've had a blood pressure case yet, knock wood, that hasn't responded and been able to get away from their medications. Mitochondria, the future of medicine, that talks about this looks at mitochondria, which are actually related to the microbiome. And so it's another book that talks about how you need to feed and fuel yourself so that you can energize the mitochondria, which produce your energy, which runs all of the systems in your body and allows you to either heal or die. Nutrient Power, it's another book talking about how important it is to get all of this nutrition from your food. Supplements are great, but they're just that. They're a supplement. They are meant to give you that little extra that you need. A thing that we tell our patients, and I hear it a lot, oh, my doctor says I'm just making expensive urine. There's truth to that. You want to make expensive urine. You want to have enough nutrition in your body that your cup is overflowing and you're getting rid of the extra. If my urine looks clear white, am I in a deficit? Am I just at the break even point? Don't know. So when I typically am always looking down when I am using the restroom and making sure my urine is bright yellow, because then I know I am getting rid of extra. And that's a good place to be. It's kind of like if you make so much money that you can't spend it all, and then you can give it away to help others. Although you're not really helping others when you flush it. And last but not least, this is a great book. I Contain Multitudes. And that really is probably the book you should start with to really start to understand the microbiome and how many different things you have in you and how that all affects, because it talks about the systems of the body and it doesn't allow you to actually break the systems down into, oh, here's your pulmonary, oh, here's your gastrointestinal. No, it says this all works together. And if one part isn't working, it affects the other parts. And we can't look at you as just pieces. You look at a person in just pieces to take the learning and put it into bite-sized bits so you can digest this and learn. But you have to actually then take it and apply it to the entire person. And that's where functional medicine comes in. That is systems-based biology. If you want to know more about functional medicine, just go onto our page here and look up what is functional medicine. And you'll see that we have a long, another 20, 30-minute video on that, on functional medicine, and it still doesn't cover everything. All right, I have spoken enough. If you have questions and you want to ask us questions, we love helping to educate, because that's what the actual etymon of doctor is. The the word that doctor comes from means teacher. So we are here to educate. And if you have questions, hit us up, Dr. Miller at integratedhealthofindiana.com. Go to the webpage, integratedhealthofindiana.com, and go click the contact us, and that just fills that in because I did that URL years ago, not thinking that we're going to be spending the rest of our lives typing in Dr. Miller at integratedhealthofindiana.com. I would have thought of something that was shorter had I thought that that was going to stick. Anyway, go to the page. You can hit us up on email. You can call Tina at 812-346-1757. Give us a call. I'll be happy to hop on the phone and talk to you for a minute or even schedule a 20-minute complimentary consult. Once again, thank you. Have a great day, and we're here to help you heal from the inside out.
Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor-patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in-person and virtual consultations. Thank you.